In another blow to members of the opposition's bench during the 6th sitting of the National Assembly on Thursday, the Minister of Health wasted no time in highlighting existing drug shortages in the health sector, which he claims was due to mismanagement by the APNU-AFC administration. Dr. Anthony divulged in his speech that a recent survey of the Materials Management Unit unearthed that hundreds of essential drugs and medical supplies were out of stock when his administration assumed office in August 2.
On the 5th of August, there were 206 items of medicine and medical supplies that was out of stock. There were 156 items of drugs with zero stock level. Put a different way, Mr. Speaker, it meant that the Apnu AFC government did not buy medicines for the people with high blood pressure in this country.
The health minister claimed that thousands of expired drugs are being housed in the storage bonds. In 2019, a $539 million drug storage bond was commissioned at Kingston, Georgetown, and another $161 million was spent towards the expansion of the drug bond at Diamond East Bank, Demerara, under the APNU-AFC administration. Meanwhile, the newly renovated infectious diseases hospital described by Dr. Anthony as a shell also came in for sharp criticism. He referred to a preliminary report which was completed by the Auditor General, which stated that the facility was inoperable.
The AFC said that this facility would have 197 beds. When we went there, we couldn't find a single bed. Mr. Speaker, Apnu AFC said this building, this hospital, would have an ICU. When we took it over, what did we find? We find a piece of space there, nothing that resembles an ICU.
A further $790 million was budgeted by the government to operationalize the infectious diseases hospital. Dr. Anthony also pointed out what he describes as an additional blunder of the previous regime's response to the COVID-19 epidemic.
When you had a person who had all the clinical symptoms of COVID-19 and they passed away, the staff was instructed not to take a sample from those patients so that we wouldn't test them, and therefore those deaths would not be accounted for.
On Wednesday, former Health Minister Dr. Karen Cummins called for a paradigm shift in the way things are done in the sector under the PPP government. She noted that while there is still much more work to be done, the APNU-AFC administration has made significant strides during its tenure. She also called for an aggressive campaign by the Ministry of Health to ensure that there is contact tracing in all 10 administrative regions for coronavirus. Temika Rodney reporting for the HGP Nightly News.